Thank you for your introduction, and good afternoon, everyone. And I would like to share with you HIFU treatment of multiple breast fibroadenoma with surgical calm. So for areas, first the brief introduction of the patient, female, 23 years old, and height 156, weight and 46 kilograms. So discovery of bilateral breast lumps for 3 years. So 3 years ago, the patient accidentally discovered a lump about the size of the thumb in the quadrant of the right breast. So initially, it was given much more attention. However, over the years, the patient noticed the lump gradually increasing in the size and now approximately the size of an egg. And now with the scar. And so before the treatment, we use this airborne ultrasound. We found 10 lumps or masses. 4 of these at 7 o'clock F and 8 o'clock A in the right breast will not be treated at the time due to consideration of the skin safety. So we have the ablation for each of these lesions. For example, we can see the lesion G turn the grayscale changes within seconds. And H lesion H also shows the changes of the grayscale within good control. And the D lesion, after 180 seconds irritation, we found that it shows the changes in terms of a grayscale. So the right for the safety issue, A lesion and B lesion are around the scar, and B is too small to be ablated. So you can see that this is the post-operative ultrasound imaging, and no swelling and or burnt after the operation, large size of the lesion C. So, and the pains are acceptable and tolerable. And now we are doing some improvement and to the solution with some solutions in anesthesia. So they will be safer and the effect will be better. So 3 days after the operation, upon surgical resection of the lesion at 3 o'clock in the right breast, so we can see that most of these cells are necrosis, about 80 to 90%. So in line with the target we set before the operation, so most of these lumps are reduced in their volume and size. And only one enlarged a little bit, and the other three untreated lesions, with one remain unchanged and two others increased very obviously. So for these multiple breast fibroids, both traditional surgical procedures and minimal invasive surgeries have limitations. However, HIFU is extremely suitable treatment option and very promising. And for patients who have undergone breast surgery, as long as a good acoustic pathway is selected and scar tissue is avoided appropriately, and HIFU treatment can still be chosen and contributing to the preservation of the patient's breast appearance. So we know breast is a very special organ for women, and so the preservation is very important and beneficial to the patients.